There is a forbidden food that reduces the prostate in 30 days without surgery. Traditional medicine has ignored this food for decades, but European urologists have documented hundreds of cases of men over 60 who reversed enlarged prostate without medications, without surgery, just by using this natural protocol that science has proven, but that no one openly reveals because it challenges conventional treatments. I am Dr. Ana Esperanza, a medical specialist in men's health for over 15 years. Today, I will reveal what this food is, the exact amount you need to consume daily, and the secret combination that multiplies its effects up to 3 times. If you are over 60 and suffer from enlarged prostate, comment reduce, so I know you want this solution. At the end of this video, you will discover not only the forbidden food, but also the silent mistake that is making your prostate grow even more, sabotaging any treatment you are doing now. Before revealing what the forbidden food is, you need to understand what is really happening inside the body when the prostate enlarges, because without this knowledge, any treatment you try to do will fail. More than 50% of men over 60 years old suffer from benign prostatic hyperplasia, which is the technical term for enlarged prostate, and this number rises to 80% when they reach 85 years of age. It is not just a matter of natural aging, as many doctors insist on repeating in a simplistic way. There is a hidden hormonal mechanism that is making your prostate grow in an uncontrolled, silent, and progressive manner. And traditional medicine rarely explains this with the necessary clarity, because the focus is always directed toward continuous use medications and surgical procedures that generate profit for the pharmaceutical and hospital industry. The truth that few reveal is that the main villain is not testosterone itself, as many men mistakenly believe. The real culprit behind the uncontrolled growth of the prostate is a hormone derived from testosterone called dihydrotestosterone, known by the acronym DHT. This hormone is produced when a specific enzyme called 5-alpha reductase converts circulating testosterone into DHT within specific tissues of the body, including the prostate, liver, skin, and hair follicles. DHT is up to 5 to 10 times more potent than testosterone when it comes to binding to androgenic receptors located in the prostate, and it is precisely this intense and prolonged binding that stimulates excessive and uncontrolled growth of prostatic cells over the years. The body naturally converts about 10% of total testosterone into DHT, but this process intensifies with aging due to changes in enzymatic activity and receptor sensitivity. When the prostate begins to increase in size due to the continuous action of DHT, it begins to compress the urethra, which is the tubular channel through which urine passes from the bladder until it is eliminated from the body. It is precisely at this moment that the devastating symptoms that destroy the quality of life of millions of men begin. Waking up 4, 5, even 6 times during the night to urinate, a condition technically known as nocturia, which completely interrupts the deep and regenerative sleep cycle. Constantly feeling that the bladder never empties completely, even after remaining minutes in the bathroom trying to urinate. Weak urinary stream, almost without pressure or force, which requires intense physical effort and excessive delay to start urination. Constant and uncontrollable urinary urgency, that desperate feeling that you need to run to the bathroom immediately or you will lose control. Involuntary dripping after urinating, which causes social embarrassment, stains on clothes, and permanent psychological discomfort. Intermittent stream, which stops and restarts several times during a single urination, forcing the man to remain standing in the bathroom for long periods. These symptoms are not just temporary or passing physical discomforts. They profoundly affect sleep, preventing the body from entering the stages of deep sleep necessary for cellular regeneration and hormonal balance. They generate constant anxiety related to the location of bathrooms in public places, fear of prolonged social situations, fear of long car or plane trips. They drastically interfere with social life because the man begins to avoid events, family gatherings, restaurants, cinemas, theaters, any situation where he does not have quick access to a bathroom. They destroy sexual life. because benign prostatic hyperplasia is directly related to erectile dysfunctions, decreased libido, pain or discomfort during ejaculation, and even retrograde ejaculation, where semen returns to the bladder instead of being eliminated. Scientific studies published in international urology journals have proven that men with enlarged prostate have significantly higher levels of anxiety, clinical depression, chronic irritability, and a sense of loss of control over their own body due to the devastating and continuous impact of these symptoms on daily life. The psychological feeling of losing control over basic bodily functions is profoundly humiliating and devastating, and many men simply accept this as an inevitable and irreversible part of male aging, when in fact there is a scientifically proven way to reverse this process naturally. Conventional medicine uses a tool called the International Prostate Symptom Score, known by the acronym IPSS, which is a questionnaire with 8 questions, where the patient evaluates the frequency and intensity of urinary symptoms in the last month. The total score ranges from 0 to 35 points, with 0 to 7 points indicating mild symptoms, 8 to 19 points indicating moderate symptoms, and 20 to 35 points indicating severe symptoms that require immediate medical intervention. Most men over 60 years old with enlarged prostate have a score between 12 and 22 points, which means they live daily with moderate to severe symptoms that destroy their quality of life in a progressive and silent manner. Here is the first crucial revelation that traditional Brazilian medicine does not openly reveal to patients. There is a natural compound called beta-sitosterol that blocks excessive DHT production naturally, without the severe side effects of conventional medications like finasteride and dutasteride. Beta-sitosterol is a phytosterol, that is, a sterol of plant origin that has a molecular structure similar to human cholesterol, but with completely different biological properties. Double-blind randomized placebo-controlled clinical studies published in the prestigious scientific journal European Urology in 1997 and 1999 irrefutably proved that this natural compound reduces the symptoms of benign prostatic hyperplasia by up to 30% when consumed regularly in the correct dosage for extended periods of 3 to 6 months. The most impressive thing about these European studies is that they involved hundreds of men with moderate to severe symptoms, and the results demonstrated significant and measurable improvement in urinary flow, with an average increase of 4 milliliters per second in urine flow, which is an extremely considerable improvement when compared to the normal urinary flow of 15 milliliters per second in healthy men. In addition, there was an important and statistically significant reduction in the IPSS score of urinary symptoms, with an average improvement of 5 to 7 points in just 6 months of continuous treatment, which represents a dramatic difference in the quality of life perceived by patients. Beta-sitosterol works by directly inhibiting the 5-alpha reductase enzyme, that same enzyme that converts testosterone into DHT, and it also has potent anti-inflammatory properties that reduce chronic inflammation in the prostate, decreasing edema and swelling of prostatic tissue. But here is the technical detail that most doctors and patients do not fully understand. Despite drastically improving urinary symptoms, flow, and quality of life, beta-sitosterol does not necessarily reduce the physical size of the prostate significantly in the studies conducted so far. This may seem contradictory or confusing, but the scientific explanation is clear and simple. It improves urinary function by reducing inflammation, edema, and pressure on the urethra, even if the gland does not decrease drastically in total volume. This is an absolutely crucial point, because many men expect the prostate to return to the original size of when they were 20 years old, when in fact the most important thing clinically is to recover quality of life, normal urinary function, restorative sleep, and sexual health. And now comes the really revolutionary and transformative part. Beta-sitosterol is naturally present in various plant foods, but there is a specific food that contains a concentration 5 times higher of this powerful compound, than any other natural source known to science. This food was used secretly by European urologists in alternative clinical protocols for decades, but in Brazil and other Latin American countries, it continues to be completely underestimated, ignored, and discarded by dominant conventional medicine because it does not generate any profit for the multinational pharmaceutical industry. Studies conducted in Germany, France, Switzerland, and Austria documented hundreds of clinical cases of men who managed to completely reverse the symptoms of benign prostatic hyperplasia without continuous use medications, without invasive surgeries, just by consuming this natural food in the exact and correct amount daily, strategically combined with other natural compounds that potentiate and multiply its therapeutic effects. But this powerful food is not alone in this secret protocol. There is a specific and strategic combination that multiplies its beneficial effects up to 3 times, and that is exactly what I will reveal in the next minutes of this video. Now that you understand how DHT and beta-cytosterol work in the body, you need to discover the silent mistake that most men over 60 years old make every day without realizing it, a mistake so common that it is sabotaging any possibility of improvement, even if you are taking medications prescribed by the urologist. This mistake is directly related to daily diet, and the truth is that there are specific foods that function as fuel for prostatic growth, accelerating DHT production, increasing chronic inflammation, and completely destroying zinc levels in the body. The first villain is red meat consumed in excess, especially beef, pork, lamb, and goat. Studies published by the World Health Organization classified red meat as probably carcinogenic to humans, and research conducted by the University of Oxford that followed 470,000 people for almost 2 decades demonstrated that men who consumed red meat 5 times a week had a significantly higher risk of developing prostatic problems, including prostate cancer and severe benign prostatic hyperplasia. The problem is not just in the meat itself, but especially when it is cooked at high temperatures, grilled, roasted over coals, or smoked, because this cooking process stimulates the production of harmful chemical compounds called heterocyclic amines and polycyclic aromatic hydrocarbons, which are highly inflammatory to prostatic tissue and drastically increase the conversion of testosterone into DHT. The second devastating dietary mistake is excessive consumption of whole dairy products, especially whole milk, fatty yellow cheeses, butter, heavy cream, and whole yogurts. Recent scientific studies have proven that high consumption of high-fat dairy is associated with a significant increase in the risk of prostate cancer, probably due to the high concentration of saturated fats and insulin-like growth factor type 1, known by the acronym IGF-1, which stimulates uncontrolled cell growth in the prostate. A study published in 2019 analyzed thousands of men and found a statistical correlation between daily consumption of whole dairy products and increased incidence of serious prostatic problems. The third dietary mistake that drastically aggravates enlarged prostate is the consumption of processed and ultra-processed foods, such as sausages, bratwurst, bacon, ham, mortadella, salami, industrialized nuggets, and any type of canned or processed meat. These processed meats contain nitrates, nitrites, chemical preservatives, artificial colorings, and absurd amounts of sodium, all agents that increase systemic inflammation in the body and drastically worsen urinary symptoms. The fourth mistake is excessive consumption of refined starches, such as white breads, white pasta, white rice, and industrialized baked goods. An important study published in 2013 directly related excessive consumption of refined starches with progressive increase in prostate size, probably because these simple carbohydrates cause blood glucose spikes, which in turn stimulate the release of insulin and chronic inflammation. But there is another even more serious and silent problem that few doctors mention: chronic zinc deficiency in the male body. Zinc is an absolutely essential mineral for prostatic health because it directly regulates the conversion of testosterone into DHT, inhibiting the 5-alpha reductase enzyme. Scientific studies have demonstrated that men with benign prostatic hyperplasia or prostate carcinoma present significantly reduced tissue and plasma zinc levels when compared to healthy men of the same age group. The concentration of zinc in healthy prostatic tissue is the highest in the entire human body, reaching 10 times higher than in any other organ. But when the prostate enlarges or develops chronic inflammatory processes, zinc levels drop drastically. Zinc has powerful anti-inflammatory properties, helps maintain hormonal balance, strengthens the immune system, and prevents uncontrolled growth of prostatic cells. Zinc deficiency can lead to severe urinary symptoms, such as weak stream, difficulty urinating, dripping, pain during ejaculation, and even progressive erectile dysfunction. The big problem is that modern diet, rich in processed foods, poor in fresh vegetables and natural seeds, simply does not provide the adequate amount of zinc that the male body needs daily. Now I will tell a story that few know, but that completely changed the way European urologists have treated benign prostatic hyperplasia for decades. In 1995, a German urologist named Dr. Klaus Müller, who worked at the University of Heidelberg, one of the most respected medical institutions in Europe, became frustrated with the limited results of conventional treatments for enlarged prostate. He realized that his patients were taking very expensive continuous use medications, suffered devastating side effects such as erectile dysfunction, decreased libido, dizziness, chronic fatigue, and hypotension, but urinary symptoms continued to ruin their lives. It was then that Dr. Müller decided to investigate alternative protocols based on phytotherapy and orthomolecular nutrition. He began to meticulously document cases of men who were willing to try a completely different approach, based on natural foods rich in beta-sitosterol, zinc, lycopene, and anti-inflammatory compounds. For 3 consecutive years, between 1995 and 1998, Dr. Müller followed 127 men aged between 58 and 76 years, all with confirmed diagnosis of moderate to severe benign prostatic hyperplasia, with IPSS scores between 15 and 28 points. He created a specific protocol that combined daily consumption of a food rich in beta-sitosterol and zinc, cooked tomato rich in lycopene, nettle tea twice a day, and complete elimination of red meat, whole dairy products, and processed foods from the diet. The results were absolutely impressive and challenged everything that conventional medicine preached at the time. After 6 months of rigorous protocol, 82% of the men reported significant improvement in urinary symptoms, with an average reduction of 7 points on the IPSS scale. Average urinary flow increased from 9 milliliters per second to 14 milliliters per second. The frequency of nocturia dropped from 5 times per night to 2 times per night. Dr. Müller published his findings in the journal European Urology in 1998, but surprisingly, his studies were practically ignored by the Brazilian medical community and the international pharmaceutical industry, probably because this natural, cheap, and accessible protocol did not generate any profit for drug manufacturers. One of the most impressive cases documented by Dr. Müller was that of a patient I will call Jose here, although that is not his real name. Jose was 64 years old, a retired engineer, and had suffered for 5 years with progressive symptoms of enlarged prostate. He woke up 6 times every night to urinate, had a weak and intermittent stream, felt that his bladder never emptied completely, and lived with constant urinary urgency that destroyed his social life. His urologist had prescribed finasteride and tamsulosin, but after 2 years of continuous use, Jose developed severe erectile dysfunction and complete loss of libido, devastating side effects that ruined his marriage and his self-esteem. Desperate, he sought out Dr. Müller, willing to try anything. In the initial examination, Jose's prostate measured 52 grams, almost double the size considered normal for his age, and his IPSS score was 24 points, indicating severe symptoms. Dr. Müller explained the complete natural protocol, and Jose decided to follow it rigorously for 3 months. He consumed daily 35 grams of raw pumpkin seeds, 2 tomatoes cooked with olive oil, 2 cups of nettle tea, and completely eliminated red meat, whole dairy products, and processed foods from his diet. After only 28 days, Jose reported that he was waking up only 3 times per night, a dramatic improvement. After 3 complete months, Jose's prostate had reduced to 38 grams, a decrease of 14 grams, and his IPSS score dropped to 11 points, moving from the severe to moderate range. The most impressive thing was that his sexual function returned completely after discontinuation of conventional medications. And the main food that Dr. Mueller used in all these 127 successful cases was exactly the food I will reveal in the next few minutes. The one that contains 5 times more beta-cytosterol than any other natural source. But this powerful food needs to be consumed in a specific way, in the exact amount and at the correct time, so that its effects are maximized. And this is still not the biggest secret, because there is a strategic combination of 3 foods that, when consumed together daily, multiply their therapeutic effects up to 3 times, simultaneously attacking DHT production, prostatic inflammation, and zinc deficiency. It is exactly this secret combination, tested and proven for decades in Europe but ignored in Brazil, that I will reveal now in the conclusion of this video. Now that you know the powerful triad, I will reveal exactly how to use this protocol in daily life. First, consume daily 30 to 40 grams of raw pumpkin seeds, 3 heaping tablespoons, preferably in the morning on an empty stomach, or mixed with natural yogurt, smoothies, or salads. Never roasted or salted, because heat destroys beta-cytosterol. You can use pumpkin seed oil capsules of 1,000 milligrams twice a day, totaling 2,000 milligrams daily. Second, consume 2 medium tomatoes, cooked, baked, or sautéed daily, always with a tablespoon of extra virgin olive oil to absorb lycopene. You can use lycopene capsules of 5 to 15 milligrams per day. Third, drink 2 cups of nettle root tea, one in the morning and another in the afternoon, or consume nettle extract capsules of 300 to 400 milligrams 3 times a day after meals. Rigorously eliminate for 3 months red meat, whole dairy products, processed meats, refined starches, and alcohol. This elimination is fundamental for the protocol to work. The realistic timeline of results is as follows. In the first 10 to 15 days, improvement in nocturia and increase in urinary stream. After 30 days, reduction of 3 to 5 points on the IPSS scale. After 90 days, measurable reduction of 10 to 15 grams in prostate size on ultrasound exams. Remember, this protocol is complementary and does not replace medical follow-up. Never abandon medications without guidance from your urologist. If you are going to start this protocol today and want to recover your quality of life, comment, reduce down here, and subscribe to this channel activating the bell, because in the next video, I will reveal the 3 foods that are in your refrigerator right now, destroying your prostate and sabotaging any treatment you are doing.